Oh, the white is the fungus?
Yeah, kind of white cottony stuff, yeah.
Wow. I see, I've never seen that in my blood before.
So does that mean this is fungus too?
Now, fungus you can sometimes mistake. You talking about these little dots?
Yeah.
The white ones?
Yeah, little dots, when you focus in and out, you know, they kind of get well, you can't hardly tell because they're so small, but they usually will get kind of teal looking or yellowish. That's uric acid. So that's some really tiny uric acid crystals. Of course, that's another white blood cell there.
Okay. Where's the uric acid crystal?
So these little dots, these little tiny dots, yeah, they're so small you can't even hardly see them.
Is that normal then?
Yeah. There's hardly any. You're going to rarely ever find anybody that doesn't have some uric acid or some fungus.
Okay.
That's just.
Boy. So these black dots are actually the white ones.
Yeah,
these are black
see, when
now.
you focus in and out, it changes and so it kind of gets darkish.
Okay.
But it's more, now like, if it didn't change, that would be plaque. Now this is your fungus.
What are those long, like these long black
these
streaks?
Here, yeah, that's uric acid.
That's uric acid, okay. This is the edge of the...
So this is an air bubble.
This is the air, yeah. And you don't see any parasites.
So far.
Is that right? And
Oh, that's a good sign.
so
Do you have pets or
what's
no?
that right there?
That's uric acid. See, this is the same.
That's a uric acid crystal.
This is the same thing as the smaller stuff. It's just larger.
Yes, I got a lot of pets.
Yeah. Okay. See, you're gonna eventually have parasites.
Yeah. Oh, that's nice.
unless you're doing parasite cleanses.
Right.
If you're doing regular parasite cleanses, you can keep them pretty much in check. Now, oval sites is hormonal imbalance.
Okay.
Yeah, so I keep seeing different sizes. It does look like your B12's off. Here's another instance of it here. So what you're looking for is trends, though. Trends in the blood.
And this right here?
That's some uric acid.
Uric acid.
Yeah, see how it's kind of like a teal looking?
Yeah, I've seen the bluish in the past.
Yeah, it's uric acid. Yeah.
Can you recognize a cancer cell?
There's not really a cancer cell per se.
Oh.
Yeah, I don't know. Doctors might tell you that. I don't know.
Oh, really?
But there's not really a cancer cell per se. It's just,
okay.
and I'm not a doctor, so I can't diagnose anything anyway.
Yeah.
And I would never try to because that would be going outside of my scope of of what I do. But I can tell you that I've done a number of people through the years that had been diagnosed with cancer, and there's a lot. This is a deep subject. There's a lot of things to it. It can depend on what we see. Like, for instance, I had a lady once had a lot of spicules, which is liver stress. So that can indicate you're on a lot of medications, too, because it stresses your liver. So I asked her, are you on very many medications? And she says, not right now. I said, well, I'm seeing a lot of spicules, which shows liver stress. She says, well, I have liver cancer.
Oh.
So that's why she had so many spicules. I mean, she had a lot of spicules, like throughout.
What does a spicule look like?
That's this one up here, right here.
This one?
Yes, the kind of like lines, like cracked glass, spider web, something like that.
Okay.
But yeah, so it would depend on, like, say, for instance, somebody had lung cancer, they might have a lot of lung toxins. So wherever the cancer is, might I've done guys before with prostate cancer. They usually have a lot of ovulocytes showing hormonal imbalance, so that's showing their PSA levels are elevated.
Okay.
But one of the synonymous things usually, a lot of fungus. There's a guy that's written a book, oncologist, years back called "Cancer is a Fungus."
Yes, I know of that one.
Yeah. So
Now these little ones that are kind of like vibrating.
that's bacteria.
That's bacteria.
Yeah, so it's a bacterial form, so it's bad bacteria.
Okay.
Yeah, bacteria moves. Okay, that is another type of white blood cell.
So do you see stress in my plasma?
You mean like liver stress?
Well, stress in the plasma, because one time there was like scratching I had.
Yeah, that I would call it. Sounds to me like that's what you're describing as spicules. So yeah, that would be liver stress.
Okay.
Which I don't. No.
Okay.
You got a little bit of more fungus here. So you got some fungus here and there. Looks like you got B12
Ivermectin.
deficiency. Yeah. So have you taken ivermectin?
No, but I keep saying I'm going to.
You know, I've had a
COVID.
couple. You know, I'm going to start going too.
Because, you know, I had
This is-
COVID, so.
Oh, you did? Okay.
Yeah.
So what does that do? Get rid of yeast?
Well, from what I'm being told, it pretty much gets rid of everything. It's like a wonder thing. So
Oh.
I'm going to try it just for the heck of it.
Yeah.
Because I'm having some crazy digestive issues, and I have actually for the last few years, which is another reason why I don't want to travel either. I ate breakfast at a hotel. Actually, it was in Vero Beach, Comfort Suites,